morning and welcome to Our Issues Milwaukee. I'm your host, Andrea Williams. Our focus this morning is on health. November marked National Prematurity Month, an opportunity to reflect on the nearly 400,000 babies born preterm each year in the U.S. and what we can do to prevent it. My first guests are Gina Harris, who is the Director of Community Engagement and Health Partnerships, and Atifa Robinson. She's a community strategist for the Lifecourse initiative for healthy families known as Life. Good morning, ladies.
Good morning.
Thank you both for being here. And as I mentioned, November marked National Prematurity Awareness Month. What are some of the things that you focused on throughout the month to help raise awareness?
Sure, right. So Lifecourse Initiative for Healthy Families actually has been around for the last 10 years or so through the university. We were designed through the university, which is a school of medicine and public health, to address the issue of infant mortality, prematurity, particularly in African American families. Since that time, we've actually spent this time, particularly this month, recognizing that we needed to do more in terms of visibility. So we've been working on our Facebook pages. We've been really trying to redesign and restructure our office as well, which I'll talk a little bit more about, given that we were, again, around for the last 10 years. Just recently, we, though, entered into what we call a reconstruction phase. And by that, I mean we are actually revamping our entire office. We're going from a very small infrastructure to an increased infrastructure. I'll introduce Ms. Atifa Robinson to you, our new strategist, as you announced.
Yeah.
Very new for us. While we've been in Milwaukee, Racine, Kenosha, we have not been necessarily having strategists in each of those communities on the ground. And that's a new structure for us. So we've been trying to launch that along with this awareness piece. We've been focusing our efforts on just becoming more visible, community conversations around understanding, building awareness around what is this whole thing called infant mortality, premature birth, and birth outcomes that have been impacting African Americans at an alarming rate, quite frankly.
Absolutely. So babies born to African American mothers in Wisconsin are nearly three times more likely to die before their first birthday than babies born to white mothers. And when we look at the numbers or the rates, period, at some point we had numbers that were as high as those in third world countries, but things have gotten better, which is good news. So Atifa, if you could talk a little bit more about your responsibility as a strategist.
I'm transitioning from the role of like Gina said, we're rebuilding our infrastructure. So the role before was the project manager, where you would just come with a strategic plan to guide the Kenosha community. So for me as the strategist, we're gonna do some infrastructure building, some capacity building, and then we're gonna also do some policy advocacy, because we wanna change some of the policies in the Kenosha, Milwaukee, and Racine area in order to reduce infant mortality, in order to improve stress outcomes and birth outcomes. So my role as that community strategist will be capacity building and community engagement and awareness and making that visibility, as well as, policies and advocacy.
Yeah, I think it's important to talk about what are some of the root causes of infant mortality.
Absolutely. It's interesting. When we first started doing the Lifecourse initiative, we obviously focused on Michael Liu's 12-point life course. So we took the whole gamut, and we were trying our best to address everything from stress to racism, right? The infrastructure, policy systems, environmental issues. But we realized that those things are significant, but we can't do everything all at once if we're going to address this. So what we've heard from the community, we spent the last 18 months, almost 24 months, asking what is it that as a community we need to, we actually should be focusing our efforts on and redesigning our work to do. And the community resonated was chronic stress in Black women, quite frankly.
Wow.
Chronic stress has to do with how they're treated at the physician's office, how they are actually engaged in community, stress around work, stress around child care, and that is it is a driver, quite frankly, that impacts birth outcomes. And so what we're going to do, as Atifa is saying, is that we're going to address stress, but we're going to use these layers and we're going to peel back some onions around how does stress actually impact not just our Black women who are pregnant, but even before they become pregnant.
Makes a lot of sense.
And yeah, and so hopefully what we'll do is actually with that bring partners to the table with us. We don't plan to do this in isolation. We can't. We simply need whether it's the health departments, we're going to focus on doulas, we're going to work with midwives, hospitals, providers, the whole kit and caboodle. But equally as important, Andrea, I want to be clear, we're going to work with the community first. The community will help drive this new initiative that we're putting together. And we'll also create, we're calling it a life strategy board.
Yeah.
It's going to be comprised of several folks to actually come together and host these conversations around, as Atifa is saying, policies, systems, environmental structures that we need to address. And we are going to address the R word, racism, this time in a very meaningful way.
And it's very interesting because we've talked about infant mortality on this show several times this year. And I hear more and more talk about doulas and the importance of people understanding the role of a doula and actually them having a connect with women in the community. So I'm really happy to see all of these organizations focusing on something that is not traditional from what we've heard about in the past. But Gina, you've worked in the field of health for many years. I mean, people probably know you from working with Alzheimer's, HIV, AIDS, and now here we are dealing with infant mortality. And I think I just figured out that we both are graduates from Central State University in Ohio.
That's
so
right.
Marada in the house.
Yes.
So talk about the importance of the work you do and being able to help spread awareness specifically in the minority community.
Absolutely. And it's interesting, folks say, well, how do you do all of these diseases or illnesses or what's really happening across all of these concerns? The reality for me is what I focus on is asset-based community development. What I mean by that is looking at what is it that the community can actually bring to the table to be resilient, because we often talk about the deficits of the community, but what we do in each of the programs that I lead, we focus on the community as a positive entity that can teach us, lead us, guide us to better health outcomes. And so for all of those areas, it's just been an opportunity to hear the voice of the community, create advocacy, and then actually create change. And so I have had that opportunity to serve in that capacity. And even now with what we're doing with the life infrastructure, we are moving from a top-down model now to that asset-based model. We're looking at organizations that are small mom and pop or that are African-American led to actually say, how do we build your capacity? It's not enough to give people money to say, go and do. It really means us coming and saying, how do we help build your infrastructure? Research dollars. What do you really need in order to be able to function and be sustainable without, if life were to ever go away, which we doubt will, how can we help make sure you're sustainable and productive for this community to be around forever to actually address this?
Good stuff. And Atifa, I want to give you an opportunity to talk about what it is you're hoping to do in this new role as a strategist and really just giving people an opportunity to get to know more about the organization you're working for.
Through Lifecourse Initiative for Healthy Families, I'm hoping across the 3 cities in Kenosha, Milwaukee, and Racine, we can actually impact some change for African American or Black families. Some of the access of care, social isolation, chronic stress, mental health. I want to really change policies for African American to receive better services throughout the community, and I want them readily available in accessible time. Under Life, we've been able to do some of those things and increase access to health care, some things about mental health and maternal mental health for African American women. But those are those key things, making sure that African Americans have educational resources, housing resources, mental health resources, as well as medical resources. That way, those things help to improve birth outcomes throughout those 3 cities. I know that I'm a community life strategist in Kenosha, and some of the challenges is maternal mental health and access to health care. And so those are challenging things that we want to push through and make sure that the legislators hear us, that we want those policies changed.
All right, well, I thank both of you ladies for coming by and sharing the information with us. Gina Green-Harris, she's the Director of Community Engagement and Health Partnerships, and Atifa Robinson, she's a Community Strategist for the Lifecourse Initiative for Healthy Families, known as LIFE. For more information on the Lifecourse Initiative for Healthy Families, visit their website at lihf.wisc.edu. When we return to Our Issues Milwaukee, we'll be joined by a woman who's committed to working with Latinos and their families every day to combat health disparities within the community. We'll meet Maria Barker from Planned Parenthood of Wisconsin right after this.